All right, I want to thank everybody for coming here today. I'm going to talk about two topics. The first one, I won't go through all that stuff. David just covered that stuff. I'm going to talk a little bit about an imaging informatics career website that we've put together and a little bit about where that comes from. And then I'm going to talk about a publication that I've put in the public domain that basically provides structure for best practices around imaging informatics. Put a structure on that. So when I talk about the IIP career website, I want to talk a little bit about why it was created and how we got to creating it as a website. In my job, I interact with a lot of different teams in medical imaging informatics, and I started to observe that different organizations had different roles and different skill sets that they required for those roles. And so you would see people who wanted to move up in their career or move to another organization, the skills that they needed or what they were going to be expected to do would vary from organization to organization. And quite frankly, over my many years of doing this, I've seen a skill set, a knowledge base atrophy a little bit as imaging informatics moved out of the departments where you're embedded in the actual workflow and moving into reporting to enterprise IT. So I wanted to make sure we as a community had a baseline of how do we know what type of skills we need. So I gave the SIM 2025 annual meeting Sam Dwyer lecture, so the keynote. And as part of preparation for that, I created this massive matrix, which I'm going to talk a little bit about. And that matrix was a gigantic spreadsheet, which for some people it's very exciting, giant spreadsheets. For many people, not so much. So we found it wasn't as accessible as we'd like. So after that was published in Excel format, a few of us, Mohamed and some others, got together and we produced it as an interactive website. And that's what I'm going to be talking about. So it's a free to use. There's no license. Anybody can use it. If you do use any content from there, we just ask you to attribute it back to the site. So I'm going to quickly take a tour. So I believe I just have to come out of here and then here. This one? All right. I don't know if you can hit like F11 to go full screen, but this is the website I was talking about. There's a couple of different main ways to go through this. One is looking at the different career paths. You'll see there's a menu at the top, so the different roles and skills. All of the content in there is organized into things that you will either be expected to know or things that you'll be expected to do within a skill area in a domain. And then each of those has three levels, like entry level, intermediate, and then advanced. And within those, we then assign that level to a job role. So, and then the other thing we have is a tool to allow you to compare roles. So if you were, say, an imaging analyst and you wanted to move to be director of imaging informatics, it'll give you a comparison to say what skill sets or what gaps would you need to develop in order to make that kind of career path jump. So if we take a look at just the roles, this is a drop down. I'll quickly show you some of the ones we have here. So it goes everywhere from clinical engineering, imaging analysts, informatics directors, IT infrastructure, PACS admins, project managers, risk administrators, et cetera. So I'm going to start with imaging analyst level 1. And when we go through this, we're going to see it gives you a description, a general description of what that role commonly is required to do. It will then go into the different knowledge domains. You'll see these bars. So this one here is technical, there's clinical, operational, and then leadership and management. So we'll start with the technical. If you look in here, you'll see, I won't go through all of it, but you'll see there's HL7, so you can click there to see the level. So in this role, it requires level 1, which it tells you what you need to know and what you need to be able to do within that job. If you took another role, say interface engine integrator, this list would be very long, there'd be more to know. The other thing that we've done is we've referenced the ABBY technical content outline, so that if you're taking the SIP exam, this tells you which section in there relates to this knowledge area, and also the practical imaging informatics chapter that covers this example. So I won't go through all of this, obviously. You can explore it on your own, but you'll see here it goes through various different areas that they're expected to know. And then if you go into higher levels, you'll see that those skill sets advance. One of the nice things about this is you can copy the content here. So if you wanted to take this content and use it in and I'll show you some examples. We have some prompts for AI to, for example, generate a job description. Or you wanted to generate a set of skill testing questions to see if an applicant met the skill sets for a given role. You can very quickly generate all that stuff. So you'll see in here, it covers all the different clinical, operational, and then leadership management. And as more you go up into more senior roles, you'll see more skills down here in the green area. So again, I won't go through all of that. I just wanted to show that. The other thing I want to show you is the compare roles. So let's say I'm an imaging analyst 1, and I would like to move up in the same field, and I want to go to imaging analyst level 2. So this will basically show me the comparison of the two, and there's a couple of different ways to view it. One is in the overview, or one is in the detailed view. And you can also flag to say, only show me what's different. So right now, you can see that HL7 goes from a level 1, and what you need to be able to do, to a level 2. And it indicates that there are new skills required there. So level of DICOM is the same in both levels, and you'll see that there's a number of different things that either newly added to that role, or that you would have to be better at. And then you can see also in the detailed view, from here you can see the various levels, and it will break down and show you exactly what you need to be able to do and know. Very boring, I get it, but it is a resource to take a look at offline. The last thing I want to show you is the Gen AI prompts. So this is an example where you can take that copy from the content that's there, and you'll see it at different levels. You can copy out of there, and for example, you can put it into a role skill gap analysis, or take your favorite LLM agent, put in there skill level breakdown and learning stages for career transition learning plan. It'll go out and find educational resources, training resources, role-based quiz question generator. So you can say, give me 10 questions that a analyst level 2 or PAX admin should be able to answer. Job description generator, and those type of things. So it's a free-to-use tool. We have a glossary as well, and this goes through all the terms that are used here, and then we also have the link to the SIM informatics terms, which is also very useful if you're learning what are all these crazy words we use. And then finally a contact. So you can go in here, and if you want to request, hey, I'd like to see this role added, I'd like to see these skills expanded upon, just tell us and we're happy to add it. So that's the one tool that we wanted to cover. The other thing I wanted to cover, let me get back to my slides here, seems to be working. And I think yep, so this is you can let us know about skills, new applications, like things you would like to see it do. We're happy to hear from you. So the second thing, which I'm going to spend most of my talk on, is a document. It's a framework, which I came up with. One of the things I found was we didn't really, as a community, have a way of organizing concepts and then providing structure or consistent structure to a lot of those things. So for example, people would talk about like AI or something, and it's like, are we talking about the strategy? Are we talking about the program to implement it? Are we talking about, what aspect are we talking about? And I wanted to create a framework so that we could in a very structured way, reference what is a best practice. As we learn, this is a best practice in structured reporting. Do we have a very structured way of describing that, or is it just a paragraph in a long narrative? So there are 4 sections to this document. I'm going to show you what it looks like, but I want to first of all go what it covers. So the first thing is governance, which makes a lot of sense. So governance in the broadest sense, it really talks about all the systems and processes which an organization or entity is directed or controlled. And it's really essential for setting the direction, ensuring effective management, and achieving the desired outcome. And it's a word we use a lot that really means oversight, but I think it's really important also for inclusion of the broad sets of skill sets and perspectives when you're trying to do something major, like change a major system or change a workflow. So why is it so important? One is without it, change can be prevented. You see it a lot where without strong governance, you see a lot of folks will passively aggressive resist a new system. They will try to prevent the job from changing, try to prevent whatever change you're going through, and there can be confusion, distrust between groups. So well done, governance provides transparency. Also, it allows people, especially those of us in imaging informatics, to participate in decision-making from the various different roles that we may have. And it's often considered in major projects, like say we're putting in a new PAX, but what I have found is very effective organizations use governance not just for major projects, but ongoing operations, workforce optimization. Like how do we actually deliver on our mission, not just deliver IT projects, which is where it gets a lot of the focus. So applying governance, this is a very simple model. Governance essentially, and these little blocks are what the framework covers, provides input to strategies, and strategies provide input to governance. And the same thing with programs. Strategies will then drive programs, and then policies and procedures. So these are the areas which I can cover in the framework. And this diagram is just to show you that there is a relationship between these areas. So a strategy, once determined, will drive a program, and then that will often also result in updates or new development in organizational policies and procedures. And all of that ties back to governance. So governance, and the document goes on a lot about some of the best practices, includes references, and I'll show you some examples. But really the meat of what we focus on in imaging informatics are the three categories that are kind of below it. So strategies, for example. So what are these? These are setting goals and priorities, actions to achieve the goals, mobilizing resources to execute on the actions. It describes how the ends will be achieved through the means by assigning resources. In this context, they're just broad plans that often encompass and traverse multiple programs and organizational areas. So you may have a strategy, for example, for enterprise imaging, and under that, you may have dozens of projects to implement in various ancillary departments, and that would be in the programs. So, but this has a general expectation of the benefits that it will apply. So I'll give you some examples here. So as I go through this, you see these little blocks. Each one of these blocks is a chapter in the framework. I've got codes, and I'll give you more detail this, so you can see these, everything is coded. So it starts with ST, means it's a strategy, and this one is about patient engagement. So there's a whole section on what are the best practices of leading organizations, what are they doing for patient engagement, and that's all in the document. Referring physician engagement and relationship management. This is about those people outside your organization who are consumers of imaging services and what you need to do to make them happy and make them safe and effective. Also, service expansion, outpatient exam volume increase. I run into this a lot where you have a large health core organization and they're looking to expand, say, open outpatient imaging centers or acquire a hospital or open an integrated medical building, and they want to basically expand that, which requires consideration of staffing, equipment, logistics, facilities, IT, everything. So it talks about all the best practices and things you need to consider. AI-based solution identification and prioritization. This is like where can we apply AI, and what is for our organization, what is the priority? Is it about scheduling and booking? Is it about diagnostics? Is it about analysis? Those type of things. Data terminology and label standardization. This covers everything from procedure terminology to series terminology, anatomy terminology, and those type of things. And this would be an example of an organization would define a strategy on how they're going to optimize their organization by adopting these standardization. Orderable imaging procedure management. This is about the strategy for how do we make sure that what the clinicians can order makes sense to them and actually results in the procedure that we want to be performed. Image sharing and access. This is both bringing images in from outside organizations or sharing them to other organizations or to patients themselves. This talks all about obviously sharing the DICOM images, but also sharing the reports and also giving access to those images through patient portals or referring physician portals. System uptime and data protection. So obviously a very key strategy for making sure that systems are actually available and functioning and data is safe, protected, replicated. So those are examples of strategies, and I'll show you an example of how it's structured. One of those is structured. It breaks down into very specific, explicit things that you can do and adopt. So in the programs, in this context, we're referring to like basically a concerted effort to monitor, measure, and improve some aspect of the organization. And I've used the term program rather than project because to me, in my mental model, projects are very discrete. They start and they end, but programs often comprise of multiple projects over several years with different resources coming in and out and have an overarching expectation of something to be delivered. It's defined by its scope and objectives. Good examples of that is, like I said, enterprise imaging. It could be also the adoption and application of AI. It's often aligned with broader organizational strategic objectives. So for example, if you have an organization that is, an objective is growth, we want to increase our annual exam volume and we want to expand that, or move into a new geographic area, or incorporate imaging from across a number of ancillary departments, not just radiology, cardiology, et cetera. So these are things that the organization may say is important to us, and that then translates into programs, which then defines resource allocation expectations. So when do we need this stuff? Usually when there's a variety of projects. If it's a one-off thing, move this server from here to here, you don't need a program. But if it's something that's going to involve a lot of resources, several discrete sets of effort, a lot of skill sets, you often need a program to define why we're doing it and keep everybody focused on that vision. And help coordinate all of those so that you get some continuity of skill set from project to project, and you have that intrinsic lessons learned that are then applied to the next project. Some examples of programs that are defined in there, like project management. A lot of organizations have an overall PMO or some methodology they've defined for how they define projects, how they define statuses of projects, how they measure costs, those type of things. And some organizations have nothing, and they just kind of wing it, or the project manager makes it up. Others have a very mature program based on best practices, and that talks about that. Enterprise imaging, this is obviously beyond the diagnostic DICOM imaging, a program around capture that, management of that, integration of that into the medical record, and interaction with it and viewing. There's a program definition on AI-based solution deployment, integration, management, and monitoring. So you can see here and I'll give you an example later, you have a strategy related to AI, but you also have to have a program. What are we adopting first? How are we going to measure it? Which users and roles are affected by it? Who do we need to train? That kind of thing. Remote reading is another one. I've seen a variety of how large organizations roll out and support remote reading workstations for radiologists, from something very advanced and well-managed to kind of like firing boxes out and hoping the rads can figure it out. So this talks about all the things that I've seen very high-performing organizations do for remote reading and managing those devices and assets, and measuring the outcome from that. Quality initiatives and process improvements. Program of that, this is often in medical education. Sometimes it's a required aspect. They have to do QI as part of that. But some organizations have a very mature process where people can, from the bottom up or top down, identify an area for improvement, define it through an SBAR or some other form, and then get it approved, and then execute it, and then measure the improvements through quality or productivity or whatever. So having some definition of a program around that is an example. Radiation dose management, I know Dr. Koff is passionate about that. Having a program around how you measure that, how you report that, how you analyze it, how you have transparency around it. Data analytics and business intelligence, specifically for imaging. I've run into a lot of organizations who have it at kind of a health level system, and imaging is sending all kinds of data in there, but then you ask them, like, how is this data coming out to be consumed for us to use in terms of making decisions in imaging? And a lot of them haven't got there yet. So this talks about how to use data analytics and business intelligence in a program. IEP professional development, this is one I often advocate for when I interact with health systems. And this is really about making sure that I run into people, somebody will have this job title, but I'm like, I talk to them, and there are things that they don't know that, frankly, they really should at that level. And when you talk to the resource managers, the directors, the others, many of them are like desperate to try and build their team, invest in their people, but they don't have anything formal. It's like, okay, you can go to MIT, you can buy this book, but part of what I talk about is, like, if you're going to have the best software, you're going to have the best project, best operations, but your people are not at the best of their game, you're really going to come up short of that. So that talks about that. So the last section, and then I'll give you some examples and I'll wrap up, is there's a whole section on policies and procedures. This is an example of where in health systems, like in my mind, policy is one thing and a procedure is another. I group these because I find a lot of healthcare organizations tend to do that. But I'll explain how they differ, what the meaning of those two terms. So policies are really, they define the rules, the guidelines, the expectations for the work, and they often explain the why. Like a retention policy, data retention policy. Why are we keeping this for 7 years, this for 10 years, this forever? What is the policy around that? And then the procedure is how you do that. So if you're talking about, say, a technologist and how they're expected to do quality assurance on an MRI exam they've sent in, what is their procedure for doing that? What checks do they need to do? What documentation do they need to do? This is their work instruction. So I've seen a lot of organizations that I've seen performing at a high level, they will have a single document that says, here's why we're doing it, and here's what you need to do, and they will manage that. They'll have governance that revisits that when they put new systems in. They will involve the people who work in those areas, and they will get feedback from them to constantly improve that. So I personally think this is the top organizations I've seen to do this. They have a standard structured template. Part of that is just the employees start to get to recognize what it looks like. It's easier to understand if each section in the policy and procedures is the same, regardless of what it's about. And so it also makes it look formal, so they're more likely to listen to it. So I think having a structured template is very useful. Some examples of ones is having a policy around patient identity management and having procedures for how do we create patient identities, what systems can do it, how do we describe them, what is the domain, qualifier? How do we do cross-referencing across those? All of those things. What records have to include that? How do we update it, do merges, all that kind of thing. So having a policy and procedure around that is an important thing, and I think this is an area that a lot of people kind of take for granted or just do whatever their EMR says. But I think it starts with you have to have an opinion of what is good, and then you make the systems help you achieve that. Imaging procedure, order placing, and scheduling, having a policy around how to do that and procedures, including things like clinical decision support for appropriate exam ordering and procedure ordering. Having a policy procedure around the imaging exam acquisition protocoling. How do you assign protocols, for example, for CT, MR, or others? Is it expected in all cases? Who does that? When is it supposed to be done? How do they document it? In what system? Imaging exam acquisition and quality assurance. So what are you expected to do as a CT tech at this location in terms of once you've submitted, you've captured the images, done your post-processing, sent it into the PACS, what steps are you expected to do in terms of documentation and triggers? And this is an important one. I'll come back to this one a little bit later, especially where what I see is you see these consolidated enterprises. We have 3, 4, 10 hospitals. Their techs do whatever they do, and now they're all operating, and the RADs are trying to read for all sites. But that same CT procedure protocoling is very different from exam to exam, and the steps they take at the end to trigger the exam as ready to read is different. So standardizing workflow is very difficult. So this is one area I think that almost everybody can improve on that area. It's a very large workforce, so you get a very big payback if you can succeed there. Imaging exam quality control, this is where you're making actual corrections to the data. Who does that? What's roles? I've seen organizations that techs do it, imaging analysts do it, PACS admins do it, the vendor does it. And if you're a multi-site organization, standardizing that and who has the permissions to do that and what changes they can make is important for that to be clear to everybody, and I recommend policy and procedure around that. Imaging exam importation and reconciliation, so exams acquired outside, how are you going to update those DICOM fields? Obviously, everyone understands applying a new accession number that's been generated locally or patient ID, but there's a lot of other fields in DICOM that you can look to best practices in terms of purging those or updating those, and there's examples cited in this policy procedure document from some IHE profiles which are very helpful. Imaging data, archiving and retention. What do we archive? Do we archive outside exams? Do we retain them? What are the policies around that retention? Enterprise imaging capture and management. What do we store where? Do we store it in the VNA, in the PACS, in the EMR, et cetera? Critical results and incidental findings. This is about how that gets communicated. Another thing I've seen with multi-site where each site from their historic sends critical results out to clinicians. One, it's through a standalone system, one is through the EMR, another one through its reporting. Now, if you're a clinician serving a patient that could show up at any of those locations, you're now dealing with, I got to check 3 areas to see if there's critical results. So this is an area that you have to have a policy and procedure and then make everybody adhere to it and get buy-in to it. Image sharing and access, policies and procedures, how you do that. Cybersecurity, what are your policies and procedures? Who in the organization could determine, do cybersecurity assessments, and what authority do they have to say you can't turn the system on or you can't use this feature? And what is required for all your IT systems. A lot of times it's a subjective opinion, but you should have a policy on that. System change control, when somebody wants to put something into production on Friday night, do you have controls on how to back that out? How do you get approvals for it? Assess the impact. And finally, change management. And people use the term change management a lot, and I'm not just talking about, oh, we got to add it to the intranet or we're going to send it out in the newsletter that nobody reads. This is really about examining those roles that are affected by what you're changing and making sure that they know how to adopt the change, why you're doing the change, and they're buying into it and accepting it. And they have resources. So I'll wrap up quickly. The framework is available. Not all the aspects will apply, so you'll go through it and say, well, this type of thing applies for academic imaging, but it doesn't really apply for us as an outpatient imaging center. So you got to pick and choose what parts make sense. And a lot of them are going to depend on your information systems, data interfaces, so they may define, here's the best way to do that, but you're like, yeah, our risk doesn't do that, so we really can't. So you may have some variance from that, but you need to make choices and at least understand how people are using those things. So I have a slide later which has a QR code, but you can just Google this and you can find it on my website. Just to give you an idea of what it looks like, so here's the consistent structure that I've applied. It has the ID and the title, has a description of what it's actually covering. So in this case, it's the governance one. Then there's a table that has each best practice, so each row is a best practice that tells you what it is, the details around it, and then what are the expected benefits? What should you gain from that? And then it has some notes, which reference either appendices in the system or external references. And it does cross-references. So, for example, this one is cross-referencing the policy and procedure around change management. It's linked to the governance. So cross-reference. So here's an example of, on the left, this is what the AI strategy looks like. On the right, it's also about AI, but this is about what the program looks like. So these two things are related. So last thing I'm going to give you here is people say, okay, that's a lot of content. Where do I start? And again, your mileage may vary, and what your starting situation is will be different, but here's some common things I say. If I was starting and I didn't know a lot, this is where I would start. I would look at your policy and procedures around imaging, exam acquisition, quality assurance. If you can reduce the number of corrections you have to make after the exam is assigned to be ready by the RAD by 10%, at a large organization, that's multiple FTEs of labor. So it's a huge payback if you can make incremental improvements there. I would take a look at how the strategy around orderable imaging procedure management. Many organizations, it's very easy for people to add procedures, and you get this long list of confusing procedures that you really want discipline around that. How those procedures are ordered and placed and scheduled, I would look at that as in terms of a policy and procedure to make sure that's effective. The strategy around uptime and data protection, strategy around patient engagement. These days, patients expect high quality service, just like we get from customer service from an airline where we can text back and forth. They want that from healthcare. Same with referring physician engagement. If you don't treat them well, they have choice and they'll send their referrals elsewhere. Image sharing and access. Policy and procedure, a strategy around AI, identification and prioritization. A lot of people are keen on it, but they have no structure of saying how we're going to go about doing this. Also looking at how the program for how you're going to actually deploy it and manage it, and the program around quality initiatives, and finally your IEP, professional development. So this is just like a pick list menu of stuff that I think these are areas I find organizations are commonly lacking against what the best practices define. And when you run into an organization that is very high performing in these areas, it's noticeable, and they have a lot of benefits in there. So if you just go to my website, and this is not a plug, it's just free, you can use it all you want. You can go there, there's a tools button, and there's a link there. This is also a link to that page. And you can just download it's a PDF, you'll be able to download it. If you have any other suggestions, like an area, you can just email me, and I'd be happy to write it up or expand on it, anything like that. So there's a lot of much more interesting talks. I do a lot of meat and potatoes, boring stuff, but thank you for your attention and your time.